And thank you very much for attending the What Works Ireland Evidence Hub webinar here today. My name is John Cole and I'm the Assistant Principal Officer in the Department of Children, Equality, Disability, Integration and Youth with responsibility for the What Works initiative, and I work with my colleagues in the unit here also today, Ciara, Catherine, Sarah and Ciara. So big welcome to you all from the department. Delighted to see you here today. Um, so we've been working in collaboration with our partners in the Early Intervention Foundation UK and the Centre for Effective Services here in Ireland on the development of the hub. So big thank you to our colleagues Jack and Mark in EIF and Lorna and Claire and colleagues in the Centre for Effective Services for helping us to get to this stage, which is a big milestone for us and for the project. So big welcome too from our colleagues in EIF and CES. So as I said, it's great to see you all here today. The level of interest has been great in the hub. We have over 100 people registered today, and we have a very good cross-sectoral mix from organisations coming from the sectors including children and family, education, health, youth, disability, homelessness, community addiction, domestic abuse, and other organisations from different sectors. So it really is a great mix, and we're delighted with the turnout here today. So I'm just going to briefly go through the different elements to the webinar today. So I'll just outline that for you. So first of all, I'll be giving a 10-minute overview on the background to the What Works initiative and why we established it. What is What Works? Some of you may be familiar with it, some of you may be not. Why established the What Works Ireland Evidence Hub and our reasons behind that. Jack Martin, our colleague from Early Intervention Foundation UK, will outline the What Works Ireland Evidence Hub. What is it? He'll also talk about what information will be included on the hub. He'll also talk about the particular programs once evaluated to be included on the hub, how to get your program on the Evidence Hub, the selection process and assessment, and then the next steps in the process. So that brings us then to finally the Q&A piece at the end. So colleagues from the Centre for Effective Services will be monitoring the questions coming throughout the Q&A function, and I'll touch on that now in a second. And so they will direct the questions during the Q&A slot to myself and Jack as necessary. So just we hope you find the webinar helpful and informative, and hopefully provide you with the answers to any questions you may have if you are considering submitting your application for inclusion on the hub. So I'm just going to go through some housekeeping first of all. So your camera and mic will be turned off during the webinar. Only the presenters will be seen and heard. So if you have any questions during the webinar, please type it in the Q&A box. So there's just a little box there to show you where it is. There's 3 dots on the very far right of your screen. If you click on that, go up to Q&A and then submit it to all, type in your question and submit it to all panelists. So we don't know if we'll be able to answer every single question during the webinar. So if a question is not addressed, or if you think of any follow-on questions after the webinar, please contact our colleagues in Centre for Effective Services at whatworks@effectiveservices.org, whatworks@effectiveservices.org, and we'd be happy to answer any queries. Just to say, the webinar will be recorded, will be available to view on the What Works Ireland website, and we'll also have the slides up on the website afterwards as well. Okay, so that's the housekeeping out of the way. So I'll just go into my presentation. Just bear with me. So why establish What Works? Well, we wanted to move from crisis intervention, which down through the years has been the case, and we wanted to move to an enhanced focus, particularly on evidence and outcomes, streamlined service delivery and integrated systems. We wanted to adopt scientific methods to measure impact of services for children. So it's all about the evidence base. We wanted to drive increased investment in prevention and intervention across all areas that affect children and young people in Ireland, to build an infrastructure and to drive that. And prevention and intervention is a key objective for the department. So we all know prevention and intervention is based on best available practice, using the best approaches and delivered by the best placed people. So we all know about the significant impacts for children and young people and on society. So it's an effective and efficient use of resources. So down through the years, there's been considerable policy practice and organisation developments in the range of sectors and settings working with and for children and young people. And one of the highlights for me, I suppose, of that is the department establishing TUSLA in 2014. There's clear international evidence as well on the long-term cost effectiveness of prevention early intervention programs, in reducing the long-term need for more costly interventions. So you could say more bang for your buck, but it's not just about the cost. It's about the impact for children and young people, and preventing further trauma and trouble in their lives down the track. And it's all about the impact on society. So if we work on prevention and intervention, the positives for society will be huge. So WhatWorks was established to harness learning from over 200 million co-investment from government and philanthropic funding in prevention and early intervention. I think that's an approximate figure, but there was a lot going into prevention and early intervention. So we want to secure a return on investment and the impact from all the prevention and early intervention initiatives to support learning and upskilling for policymakers, providers and practitioners. And for anyone with interest in prevention and early intervention. Alongside our thinking about WhatWorks, Department of Public Expenditure and Reform established a prevention early intervention unit. So that was an interesting project as well, alongside WhatWorks. So the groundwork to WhatWorks starts in 2016. The initial thinking, there was a landscape analysis, national, international expertise, consultations, etc. So WhatWorks was formally launched in 2019, and we have a current budget of 2.2 million. I think the initial budget set it up, I think the first year was 2.6 million, if I'm not mistaken. So what is WhatWorks? So WhatWorks, under Better Outcomes, Brighter Futures, it played a critical role in progressing prevention and early intervention initiatives. It was a cross-sectoral priority, and we met regularly on it with colleagues across government departments, and we dealt with the NGO sector. So it's going to be a cross-cutting piece in the forthcoming National Policy Framework for Children and Young People, which we think is due to be published end of Q1 next year. March, April, maybe. We just don't have a definitive date. So WhatWorks takes a coordinated approach to enhance capacity, knowledge and quality in the prevention and early intervention sector. And it aims to maximise the impact prevention and early intervention, basically improving outcomes for children and young people living in Ireland. So what is it about? Well, when we were looking at WhatWorks back in the day, we wanted to have an approach to embed prevention and early intervention in the systems surrounding children and young people and their families. So we identified 4 strands that required focus effort. And if you want more information on these strands, they're on the WhatWorks website. These 4 strands are enhancing access and use of data, enhancing access and use of evidence. So the Evidence Hub fits neatly into this strand. Supporting the capacity development of the workforce to adopt an evidence-informed approach to prevention and early intervention services. So we've done a lot of work on this through our various funding schemes, which I'll touch on shortly, and developing mechanisms that guarantee quality assurance in prevention and early intervention. So there's just a graphic just about the 4 strands, and in the centre you see children, young people and their families in the centre, which is we're aiming for positive outcomes for that cohort, which, as I said, impact on society in a positive way. So you may ask, what difference is WhatWorks making? So, it's all well and good establishing these initiatives, and is it all talk or bluster, or what is it all about? So it really is a first for Ireland. So we brought together the key learning in prevention and early intervention from different initiatives, practice fields and organisations. So we're not there yet, it's ongoing. It speaks to the need and supports for children and young people and their families. So it's more about taking a strategic and practical approach. So the end goal is to improve the access, understanding, quality and use of data and evidence through resource development and training and coaching. So we've done a fair bit on the training and coaching piece, and working with different organisations, and we have had feedback and evaluation reports and videos, which are on the WhatWorks website, from our various funding initiatives and projects. So we've had the Digital Solution Fund, our Training Fund, a Learning Together Fund, and the most recent one was the Sharing Knowledge Fund in 2022. The project that started on that, we issued €409,000 to 25 organisations. And we've did an action learning project this year. We've quality implementation training across TUSLA service areas, and that's been expanded, and we've had great feedback on that. And we hold an annual festival learning each November, and we've one coming up starting the week of November the 21st. So that's a little plug for that. If you're not aware of it already, please look out for emails on that if you're on the mailing list. And we've supported various TUSLA prevention early intervention projects. And what we're doing is working with TUSLA on those and trying to upscale those and provision of further funding for those next year. But we also want to look further at data and the evidence around that. So keep your eyes peeled for any forthcoming initiatives and funding opportunities for next year. We're just looking at our program of work for 2023, and we'll be issuing communications around that. Just to sum up, HOTWORKS is designed to nurture, grow, and champion evidence-informed prevention and early intervention approaches. So it's a coordination effort to support a whole system approach to prevention and early intervention in Ireland. I think I've come on to my last slide. So, yeah, why the HOTWORKS Ireland Evidence Hub? And Jack is going to speak shortly on this and explain what is the hub. It's a first for Ireland. It will speak to an Irish audience and help practitioners from an Irish perspective, utilising evidence and best practice. But you will also have access to over 100 programmes across the UK and the 10 that we're going to evaluate for Ireland. So you'll have access to all that on the hub. It'll harness learning from prevention early intervention initiatives and research, and actively support the use of this learning as a source and resource to inform planning, delivery, evaluation, and continuous improvements. So practitioners, whoever is interested in prevention early intervention, can go onto the hub, look at initiatives that have been evaluated, and look at the evidence and see if that can help them to continue their own, to continue to work and to improve their own organization's abilities in terms of prevention early intervention. So to make the best evidence on what works available to policymakers, service commissioners, providers, and other audiences, and helping their decision making. It'll be helpful for people who are undertaking research. Basically anyone with interest in prevention and early intervention. So before I hand over to Jack, just to say, if you want to submit your Q&A questions, just go over to the far right, on the bottom of your screen, the very far right, just 3 dots. Click on that, go into Q&A, enter your question, and submit to all panelists. So with that, thanks very much. I'm going to hand over to Jack now. Thanks, Jack.
Thanks, John, for that introduction. Yeah. Hi to everybody who's attending today, and thank you very much for being here. I'm just going to get control of the slides. Fantastic. So my name is Jack Martin, and I work for the Early Intervention Foundation, and I'm a social researcher who leads the Early Intervention Foundation's work on its guidebook, which you'll hear a bit about today. And I will be leading the research work that goes into the Evidence Hub. So today, building on what John has already shared, I'd like to cover 4 things. The best place to start, I think, is explaining what the Evidence Hub actually is. And then I'd like to describe in more detail what information and content will be included on it. And then I'd like to dig deeper into the submission process for getting your program included on the Evidence Hub. And then, as John said, we'd like to close with us answering some of your questions. So the Evidence Hub will be a searchable online database of information about prevention and early intervention programs. And the Hub won't be limited to a very specific type of early intervention program. Rather, it will cover a really broad range of policy and service areas. And it will contain information on the delivery and implementation of programs, and the evidence base of programs, and the costs and benefits associated with programs. By information on delivery and implementation, we mean information on who the program is delivered to in terms of the target population's characteristics, age, and level of need. We mean information on who a program is delivered by and what needs to be in place to support them. We also mean information on the duration and frequency of program sessions and whether a license is required to deliver a program. By information on the evidence base, we mean a description of the scientific evidence that investigates the impact of a given program, including where those studies have been conducted, what sorts of samples were involved, how impact was measured, and the findings of those studies. And we also include a strength of evidence rating, which summarizes how strong or trustworthy the evidence of improving outcomes for children is. And then finally, by information on cost and benefits, we mean information on how resource intensive a program is to set up and deliver, information on what sorts of outcomes the program has evidence of improving, and information on how much the program has improved those outcomes, so the size of the program's effect. And to give a bit more context on the Hub, the development of the Hub is a project under the What Works initiative, developed as a collaboration between DCE DIY, the Early Intervention Foundation, and the Centre for Effective Services. DCE DIY, who has initiated and funded the work and continues to guide it, the Early Intervention Foundation, who is producing the content for the Evidence Hub, so the descriptions of the programs, the ratings of evidence, and the Centre for Effective Services, who has contributed their expertise to the development of the Hub, as well as organising aspects of the call for submissions and indeed these webinars. And the Evidence Hub will be based on an existing tool, which you may or may not have heard of, called the Early Intervention Foundation Guidebook. And because of that, it might just be helpful for me to quickly give some information on the Early Intervention Foundation and on the guidebook by way of context for this work. So EIF was established in 2013 and is one of the UK government's What Works centres, which are organisations designed to support the generation and use of evidence in order to improve the design and delivery of public services. And EIF, unsurprisingly, focuses on early intervention, which we define as support across a wide range of policy areas provided to children and young people who are at risk of experiencing adverse life outcomes, designed to prevent those adverse outcomes from materialising. And our guidebook was launched shortly after the organisation was set up, and it is effectively the UK version of the Hub, the UK online database of information about prevention and early intervention programmes. And some key characteristics of the guidebook include, firstly, it focuses on programs. And by programs, we mean well-structured and clearly defined packages of activity that are replicable, have clearly defined outcomes and costs, and the means to provide the required quality of delivery, either through fidelity to a manual or through other forms of workforce support, monitoring, and evaluation. At the moment, the guidebook doesn't include information on broader practices, by which we mean specific skills, techniques, and strategies which are used by practitioners on their own and outside of the context of a program. Secondly, the guidebook focuses on programs with at least preliminary level evidence of impact. And we'll say a bit more about what that means later, but this does mean that programs don't need to have gold standard impact evaluations like randomized control trials to be included, but they do need at least some quantitative research investigating their effectiveness. Many similar resources to the guidebook only include the most highly evidenced programs. We decided to include a broader range of interventions at different stages in their development of evidence, because we wanted to have a more comprehensive resource that could include smaller local programs that may, at the moment, have lower levels of evidence. And then thirdly, the guidebook includes evidence from around the world, not just from the UK. So while we try to spotlight and highlight evidence from the UK in our guidebook, we include evidence from other countries too. And we took that decision because there are relatively few interventions that have robust evidence of effectiveness from the UK. So it's useful to know what well-evidenced approaches exist overseas, because this can serve as a useful pipeline of promising programs that could be transported over. Though, of course, there is no guarantee that something that was effective overseas will be effective in any other place. So the guidebook has existed for almost 8 years, but caters primarily for a UK audience. So when we say the Evidence Hub is based on the guidebook, we mean that it will contain similar information on the same set of programs, but it will be adapted so that it is more useful for Irish audiences. So, for example, financial amounts will be presented in euros. The outcomes programs have achieved will be categorized according to the Better Outcomes, Better Futures framework. The Evidence Hub will also contain Irish-specific information on the delivery and implementation of programs, and where available, island-specific contact details will be included to make it easier for Irish decision makers to get in touch with the most relevant representatives of a program for them. In addition, the way the Hub describes programs in terms of the settings they are delivered in and the qualifications required to deliver them will be expressed in terminology and frameworks used widely in Ireland. And finally, evidence from Ireland will be spotlighted. So we've spoken a bit about what the Evidence Hub and the Guidebook are, but why are we doing all of this? I suppose the ultimate aim is to support the use of evidence in early intervention and prevention policy and practice, particularly by supporting decision makers and service commissioners to invest in effective evidence-based early intervention. We think it's important that decision makers, when deciding which programs and services to invest in, factor in what the evidence has to say about the track record of a program in improving outcomes for children and young people. But getting on top of the evidence, finding all of it, assessing how robust or trustworthy it is, and then interpreting what it says is difficult and time-consuming work. So the Evidence Hub and the underlying research aims to do that for the decision maker, for the user, and present it in a way that is accessible, useful, and convenient to consult. However, we do think the Evidence Hub will be useful for other audiences, such as practitioners and researchers. So that's what the Evidence Hub is and what it's for. But I think it's important to say a bit more about how we think it should be used and what we think the main caveats are. So the first thing we'd like users to bear in mind is that the Evidence Hub won't be an exhaustive list of prevention and early intervention programs. And that has the consequence that users shouldn't overinterpret the fact that something's not included on the Evidence Hub. Not being on the Hub doesn't mean that a program doesn't have good evidence or isn't promising. It might just mean that we haven't been able to assess and include it yet. The second thing we'd like users to bear in mind is that the Evidence Hub will not be a list of approved or kite-marked programs, nor does simply being included on the Hub mean a program has robust evidence of effectiveness. All that inclusion on the Hub means is that we've assessed that program and that it has at least some early preliminary evidence of impact. You need to look beyond a program simply being on the Hub and engage with the content to find out more. And that finding out more is really important and leads on to the other key point, which is while we think that rating, the strength of evidence rating, which I'll talk about more in a minute, on how strong a program's evidence is important. It isn't everything, and a high rating certainly isn't a guarantee that a program will be effective in or appropriate for any given context. The rating ultimately tells us if something has worked in the past for a particular population under a particular set of circumstances, but it doesn't tell us if something will work in the future for a different population under a different set of circumstances. So it is not and cannot be a guarantee that something will work. So when looking at programs on the Hub, we need to use professional judgment and local knowledge to ascertain whether there's a good fit between the circumstances in which a program has been successful in the past, which the Hub will tell you about, and the circumstances in which you propose to introduce the program. The more similar that they are, the more likely you are to see similar results. So for example, we need to think about things like the characteristics of the people you intend to support with the program, perhaps in terms of their age and socioeconomic status, and whether they are similar to the people the program has successfully helped in the past. So a program simply receiving a high rating doesn't mean it's the right program for you. Similarly, a program receiving one of the lower ratings doesn't necessarily mean it's not the right program for you. It is true that the evidence is less secure for those programs, so we think it's really important that they are evaluated robustly. But there could be excellent programs receiving those lower ratings that perhaps are relatively new and just haven't had the opportunity to be fully evaluated yet. Also, for any given circumstance, there might not be an appropriate higher rated program available. Perhaps there are no higher rated programs that aim to improve a specific outcome or any higher rated programs that are designed for a specific population, in which case it's important for users to consider those lower rated programs. So we think those caveats are important and they will be communicated alongside the Hub. So now you've heard quite a high level what sort of information will be on the Hub. And I think now I'll dig into that a little bit more so you know exactly what to expect from the Evidence Hub and exactly what sort of information we would publish on your program if you go on to be included in the Hub. And particularly, I'd like to say a bit more about those evidence ratings that I've been mentioning. So there's broadly 4 sets of information that will be included on the hub. The first is those ratings and summary information. The second is information on key program characteristics, so a sort of at a glance sense of what the program is. Information, more detailed information on the theory of change and implementation requirements for the program. And then finally, detailed information on the evidence base of the program. So starting with those ratings, the Evidence Hub will contain a strength of evidence rating, which describes the extent to which a program has been shown to have a positive impact on child outcomes in robust evaluations. And I'll discuss that in more detail on the next slide. The Evidence Hub will also provide a rating of cost, which is based on a broad estimate of the relative unit cost of the program in terms of how resource intensive it is to set up and deliver. And by that, we mean the cost to support one child or young person with the program. And that rating is based on information that program providers give to us about the resources required to set up and deliver that program, such as the practitioners delivering it, the cost of training and program materials, and so on. And we summarize cost on a relative scale from 1 to 5, where 1 indicates the least resource intensive programs and 5, the most resource intensive programs. And each of those 1 to 5 cost ratings is associated with an indicative range of unit costs in euro, and we're currently determining exactly how that will work. But the idea is that this rating, the idea isn't that this rating provides a perfect estimate of the market price of an intervention, which might be variable or commercially sensitive, but rather to give a broad sense of the expense involved and to allow for comparisons between programs on the hub in terms of how resource intensive they are to deliver. And then finally, we also provide a summary of the outcomes that evaluations of a program have identified. So returning to those strength of evidence ratings, we call the process by which we assign a strength of evidence rating program assessment, in case you see that terminology in any of the documentation. And that is a process that all programs need to go through to appear on the Evidence Hub. And that process involves gathering all of the relevant evidence for a program and then assessing its quality according to EIF's evidence assessment criteria. And you can sort of think of this like a checklist of 34 features of evaluation that we think are important components of high quality, robust impact evaluation. And they cover aspects of study design, properties of the recruited samples, the extent to which participants were retained in the study from beginning to end, how outcomes were measured, whether those measures are valid and reliable, and features to do with the statistical analysis of outcomes. And on that basis, you end up with one of 5 ratings, and you can see these ratings in that diagram on the slide. So up at the higher end, we have level 3 and 4 programs, and those are the programs that we describe as evidence-based, and that's because they are underpinned by studies that are sufficiently robust, meet enough of those 34 quality criteria that we can conclude with confidence that there is a causal link between participation in a program and improvements in outcomes. And a level 3 program specifically is one that has at least one robust evaluation, by which we mean a high quality randomized control trial or a high quality quasi-experimental design. The difference between a level 3 and a level 4 is that a level 4 rating recognizes programs with multiple robust evaluations and in addition have robust evidence of longer term impact, by which we mean a year after the completion of the intervention. And moving down the scale, level 2 programs are programs that we say have preliminary evidence of improving child outcomes. So level 2 evidence might include comparison group studies that don't meet the level 3 and 4 criteria, as well as simpler evaluation studies like one group pre-post studies where you measure participants on outcomes before and after they undertake the program, but with no comparison group. And we call that evidence preliminary because it exhibits some strong features. So a certain percentage of the sample will be retained, valid and reliable measures are used to assess outcomes. However, unlike with the higher ratings, it just isn't the case that all sources of potential bias are controlled for. So we can't determine with absolute confidence that there is a causal link between participation in a program and improvements in outcomes. And then we have 2 further ratings. So Related to our level 2 rating is our not level 2 rating, and that describes programs that don't yet have what we consider to be preliminary evidence of improving child outcomes. And programs falling into that category are typically at earlier stages of their development and doing that really important foundational work of developing a theory of change, drawing up a logic model, feasibility testing to make sure that the program can be delivered well and can reach and retain the sorts of people it needs to. And then the final rating is the NE or no effects rating. And that recognizes programs that have been found not to be effective or found to be harmful in at least one robust study. Moving on from the ratings, so we also provide some at-a-glance information on the key characteristics of programs, including who they're for, where they're delivered, how they're delivered, and where they've been implemented and evaluated. We also provide, on top of that at-a-glance information, more detailed information for those who want to learn more about a program. So specifically, how long a program is delivered for, the background and qualifications of those who deliver it, and other features to do with the implementation of a program. And please do be aware that this information will be ultimately provided by you rather than produced by researchers at the EIF. And we also include information on the theory of the program, so how it's supposed to work, the underlying science it's based on, and the intended outcomes. And also, again, note that this information will be ultimately provided by you. And then finally, we also provide, beyond the evidence rating, detailed information on the evidence supporting a program, and that includes where the studies have been conducted, what sorts of samples were involved, the evaluation methodology, if a program is evaluated using a comparison group study, what was it compared to, how impact was measured, and more detail on the findings of studies. So that's the kind of information we publish on programs. But I suppose then the question is, how do we get there, and what's the process for programs being included on the hub and for pulling all of this sort of information together? And there are broadly 9 stages to the process of getting a program included on the Evidence Hub, and I'll go through each of these in turn. So the first stage is just letting us know about your program. We want to hear from you about the great work in prevention and early intervention being carried out in Ireland. And we think that the Hub and this call for submissions is an exciting opportunity to spotlight your program and the evidence of its impact for children and young people. And we're interested, as I said before, in programs from a really wide range of areas meeting prevention and early intervention needs. And, bear in mind that the only input required from you throughout this whole process, the only cost is your time. So time to fill in the submission form, to provide us with details, and to digest and respond to the materials that we send you. And we'll give you plenty of time to do all of that. And submitting is easy. Please find the online form and guidance on the What Works website. And please do note that the submission period closes on the 8th of November. We'll be selecting 10 of the programs to be submitted to us. And do note that those programs will appear on both the Hub and the EIF guidebook that I was mentioning earlier. And when you get into that online form to submit, you'll be prompted for the following sorts of information. So firstly, we want to know about you. We want to know some details about you, the name of the person who's submitting the program, your email address, and your relationship to the program being submitted. And note that you don't have to be the program developer to submit a program. You could be a provider of a program or someone who has worked on an evaluation of a program, but we would just ask that you have the full support of the program developer when you do submit a program. Then we'd like a brief description of your program, and that's just to give us a flavor of what your program is about. What activities are carried out as part of the program? Is it delivered to young people or members of their family or someone else, or all of the above? Is it delivered to groups of people, or is it delivered on a one-to-one basis? So we won't be assessing that description in any way. It's just so we know more about the work that you're doing. We'd also like to know more about the aims of your program. In particular, does it explicitly aim to improve outcomes for children and young people? And if so, what sorts of outcomes? So to go through to the next stage, we do require that submitted programs have an explicit aim of improving outcomes for children and young people. It might aim to generate benefits for other groups along the way, like parents, caregivers, teachers, or professionals, but it does need as an end goal to aim to improve child outcomes. And then we'd like to know more about the groups your program intends to support. So what age groups does your program work with, and what's the level of need of this population? Is your program universal and it's for everybody, or does it work with a smaller group of younger people with higher risk of adverse outcomes? So to go through to the next stage and to be selected, we do require that submitted programs aim to improve outcomes for children between the ages of 0 and 18. And then we'd like to know more about the evidence that exists that investigates the impact of your program. We'd like your submissions to focus on impact evaluation, so quantitative research studies that aim to measure the impact of a program and determine whether an intervention has successfully improved child outcomes. So designs including but not limited to randomized control trials, quasi-experimental designs, one group pre-post designs, and so on. We don't require that what's submitted has been published in academic journals or peer-reviewed, just that it provides enough information on the research methodology such that we can assess it properly and have all of the details that we need. We'll also accept evaluation studies conducted outside of Ireland. The strength of evidence rating is based on the overall strength of evidence, including evidence conducted internationally. So we'll accept a range of different types of evidence from different places, but do note that when we are selecting our 10 programs to assess, we will be prioritizing programs with more robust forms of evidence, and we will also be prioritizing programs with studies that have been conducted in Ireland. And then finally, we'd like to know more about the delivery of your program in Ireland. So we'd like to confirm with you that the program is available in Ireland, and that is required for a program to go through to the next stage. We'd also like to know how widely delivered your program is in Ireland in terms of a rough estimate of the number of children who receive the program in a given year, and in terms of the number of counties the program is delivered within. And if we receive a large enough number of high quality submissions, we may prioritize programs that are delivered to more children and delivered more widely in Ireland when selecting those final 10. So the second stage is, once we've received a final set of programs that have expressed an interest in being included on the hub, we'll then apply those selection criteria to select 10 to assess. And we're planning to assess 5 in this financial year, so 2022 to 23, and then 5 in the financial year following, 23 to 24. In an ideal world, we'd love to include every program that expresses an interest and is eligible, but assessing programs is just a time-consuming, resource-intensive piece of work, and we will just need to prioritize for this round of assessment. And I've already spoken to the selection criteria, and they are described in detail on the What Works website in a background paper, so please do have a look at that. But to summarize, we're aiming to prioritize programs that explicitly aim to improve child outcomes, have promising or strong evidence of impact, from Ireland itself, and are available and relatively widely delivered in Ireland. And we will get in touch with all applicants in November with the outcomes of the process and whether they'll be taken forward to assessment. So if you are selected for assessment, you will be given the choice whether to proceed. So if you've decided you don't want to proceed, you can pull out of the process. We really hope you don't, but be assured that submitting to the call for submissions itself does not commit you to anything. If you do decide to proceed, you'll be asked to agree to a set of terms of reference, and those will be shared in full with selected providers at the time. But really, it boils down to, firstly, confirming your understanding and your consent to the overall process, confirming your consent to the process for appealing the assigned evidence rating, should you disagree with us about what that should be, and then confirming your consent to EIF, ultimately retaining discretion as to whether a program is included on the hub and the rating assigned to it, subject, of course, to the outcomes of any appeals process. And I'll explain that process to you shortly, but what it boils down to really is, if you think your rating is wrong, you will absolutely be given a fair shake to explain why, and that will be taken seriously, and it will be considered by an independent party and we'll work hard with you to resolve any issues. But it won't be possible to simply pull out of the process and halt publication if you're unhappy with a rating and it cannot be demonstrated that there's a fault with it. So once you've been selected and once you've confirmed your willingness to proceed, we'll then ask you for more detailed information on your program, building on what you've shared with us in your initial submission. And we'll ask you to provide that through 2 online questionnaires. And this is effectively just more detail on the pieces of information that I described earlier that will be published on these pages. And then after this, we'll confirm with you which evaluation studies that will be considered when we're assessing the evidence and arriving at that strength of evidence rating. So you'll already have told us about your evaluation studies when you submit to being involved, but we'll give you an opportunity to add anything you might have missed initially. And we'll also conduct a literature search and add in anything additional that we might find. And then we'll confirm that final list with you. And then begins the process of assessing the evidence. And we've spoken about the methodology behind that already, but in terms of the process, trained researchers at EIF will apply our evidence assessment criteria and come to a provisional strength of evidence rating, which will then be quality assured by a senior member of our evidence team. That provisional rating will then be scrutinized in detail at what we call a review meeting, and that will include an independent expert who has subject matter knowledge in the area relevant to the intervention and expertise in research methods. At that meeting, we debate the rating and agree a final rating to be shared with you, and we share that in the form of a detailed report, which is just for you and explains which criteria we think were met, which we think weren't met, and why, and how all of that adds up to your rating. So it's intended to be super transparent and as easy as it can be to understand and engage with. Now, I'm conscious that I'm running out of time, so I'm just going to skip some of the slides that feel less essential. So moving to the end of the process, as I said, once we've conducted our assessment, you get that detailed report. So we work hard to make the process objective, transparent, rigorous, and fair, but some may still disagree with the final assessment. So before we publish any information, we give you at least 3 weeks to digest the materials, request changes to wordings, and then to request a reassessment of your strength of evidence rating if you wish to do so. And your request for reassessment, which we request in written form, needs to make the case that we have misapplied the evidence criteria. Your request for reassessment can't be considered if it objects to the EIF evidence standards and the evidence criteria themselves. So in other words, your case needs to explain what's wrong with how we've applied those rules rather than explain what's wrong with the rules themselves. So for example, it's possible that we've misinterpreted a line of text in your study report and we think study attrition was higher than it actually was. This is your opportunity to say, actually, attrition was at this level, and this means that on your evidence criteria, this should receive a higher rating. And those requests for reassessment are then considered at an additional review meeting, which we call a moderation meeting, and that will include a different independent expert who was not involved in the initial rating. And the original assessment, the request for reassessment are then discussed, and a final decision on the rating is come to and communicated to you. And then just very, very quickly, so to end on a bit of a status update in the sense of what happens next, in terms of the launch of the hub, DCE DIY plan to launch the Evidence Hub in early 2023. We are now in the process of receiving your submissions so that we can add additional programs to the hub. And please be advised that your submission should be in by the 8th of November, please. And then finally, in addition to this webinar, we're planning a range of others over the next 2 years, designed for different groups. So please keep an eye out for that. I've been speaking for a long time, so thank you ever so much for listening. I hope that this has cleared up some elements of the process which may have been unclear, and we look forward to hearing about the work that you're doing. And I think now we have some time for John and myself to answer some questions. And apologies in advance if there's anything we've forgotten, need to think about a bit more, or need to double check. We will find a way of getting considered answers to you after the session, if that happens. Thanks very much.
Okay, thanks, Jack. So some questions have come through. So first of all, there's some questions about whether the slides from today would be shared. So yes, the slides and the recording of the webinar will both be available on the webpage for the Evidence Hub. We've shared the web address for that in the chat. So first of all, there was a question perhaps to you, John, it's more relevant for you, a question about whether there will be upcoming funding to support organisations who might be working with third level institutions to advance their evidence base.
Yeah, as I said earlier, thanks, Lorna, we are looking at our funding opportunities for next year and what we need to do in the what workspace prevention, early intervention. So we'd be quite happy to speak to anybody on that. So we are looking at particular funding streams for next year. As I said, I can't give any commitments to anything at the moment, so we're still waiting on our funding allocation, but we are open to looking at anything that fits under the What Works initiative. But I can't give any guarantees, but we're happy to chat to people and have an initial chat on that.
Okay, and kind of related to that, I suppose, is the question around whether there'd be further opportunities to submit a programme on a more ongoing basis, or what you see in terms of the continuity of that after the 8th of November.
Yeah, so for the moment, we are evaluating 10, or EIF will be evaluating 10 programs on our behalf, 5 initially, and then another 5 in 2023, early 2024. But you know, a lot of work has gone into this project with our colleagues in EIF and Centre for Effective Services. So you know, we didn't establish this project just to sit still. We want to progress this and keep adding to it. For the moment, this is our, I suppose, baby steps, if you want. We're focusing on the 10 programs with the deadline of November the 8th for submissions. However, we will be sitting down and reflecting next year on the possibilities for a continuation and another call for submissions. But I can't give an absolute cast iron guarantee at the moment, but we're very enthusiastic about it. We want to continue with it, and I'm very, very hopeful that will happen, that we will put out another call and ongoing calls. It'll be a gradual process. So yeah, so I would imagine we would be doing it, but it is tied to the funding that we have available year on year. But I'm very hopeful.
And sorry, just to add to that, John, so it is worth saying that EIF independently do assessment of programs and may run its own open calls over the next few years. So that's another route to get onto both the guidebook and the hub. So it's worth following EIF on Twitter, subscribing to the newsletter to pick up on assessment opportunities outside of this round of 10.
Thanks, Jack.
Okay, so moving on to another question. I think this would be for you, Jack. If a programme is already included in the existing EIF guidebook, do they still have to apply for inclusion in the Evidence Hub?
Thanks, Lorna. So no need to apply for inclusion in the What Works Evidence Hub. The programs that appear on the EIF guidebook will appear on the Evidence Hub. Something we have done is we've sent around a questionnaire to program providers with programs on the guidebook to prompt them for supplementary additional information that would be useful to include for them on their equivalent entry on the hub. So if you are a program provider with a program on the EIF guidebook and you haven't received that, then please do send us an email at guidebook@eif.org.uk and we'll get that to you and sort that out. Thank you.
Okay, so some of these questions have been added to the chat, but I'll just read them out anyway in case everyone hasn't seen them. So another question for yourself, Jack, was where programs relate to drug use, does the assessment process for inclusion on the Evidence Hub take into account their compliance with international prevention standards?
Good, yeah. I mean, good question. I mean, the guidebook and by extension the hub just contains such a broad range of interventions across different policy areas, focusing on different outcomes. So, I mean, I think the answer to that is no. The assessments are sort of simply a reflection of what we see as the strength of the evidence from a methodological standpoint, rather than a reflection of other things, I suppose. Hope that answers the question.
Okay, and then any questions or any further questions on this that may not be fully addressed today can again be submitted to the WhatWorks email address, as John has said, if any further explanation is needed. But then finally, another question here on where assessment and evaluation is ongoing and the substantive evidence will be available at the end of December. Can the programme submit supplemental evidence post the 8th of November deadline?
Yeah, good question. So we're hoping to select the programs to assess in this financial year pretty soon after pretty soon after the end of the submission date. So research published after that might be difficult to accommodate in that. I mean, if you're selected for the final 10 on the basis of the evidence you do have, then I think it would be possible to, as part of the ongoing assessment work, factor in additional assessment that is published over that time frame, provided it's sort of to the beginning of the process rather than the end of the process. And I suppose another thing that I didn't touch on in my presentation is these assessments aren't a one-off. We don't do it once and then just leave it there to get dusty, because new evidence is getting published for programs all of the time. So we call it maintenance. We're sort of actively maintaining the guidebook. We hope that program and indeed the hub, and we hope that program providers get in touch with us and let us know when there's new evidence for their program, so then we can assess it and update their hub entries. And indeed, we do literature searches sort of every year to 2 years to make sure that our entries on the hub and on the guidebook are as up to date as possible with respect to what the evidence says.
Okay, so just another question here on, is a cost benefit necessary for the hub? So I presume that, I mean, does there need to be a cost benefit analysis submitted as part of the evidence?
Yeah, I mean, please do feel free to send that as part of the package of materials that you send to us as part of your submission. But no kind of formal, all singing, all dancing cost benefit analysis needs to be done to be eligible. When we do I spoke a bit about those cost ratings, didn't I? When we do that, that's based on we send you a questionnaire and it asks you some features about the sort of input. So we might ask you as part of that, how much do delivering materials cost or something like that. So we will be requesting cost information from you, but it doesn't need to be in the form of some sort of exhaustive cost benefit audit that's published.
Okay, and then another question for you, Jack. Do the programs that are submitted, do they have to have been developed by the organization that submits them?
No, I don't think so. I think it's okay for a range of people to submit to this open call for submissions. I think we just would ask that in your submission, you're clear about who you are and what your relationship to the program is, and that you have the sort of full approval of the program developer when making your submission, and pull them into the process at relevant points on an ongoing basis.
Okay, and one last query for now, unless others come in. Is the WhatWorks Ireland Evidence Hub, is it only for interventions with children, or can it include interventions with parents, families and communities?
Yeah, of course. So the program has to ultimately aim to improve outcomes for children and young people, but it doesn't in any sense have to be delivered directly to children and young people. So it can be a program that's delivered to teachers, other professionals, parents, families, other members of the community. All of that is accepted. So the intervention doesn't need to directly work with children. It just needs to aim to ultimately improve outcomes for children and young people.
Okay, so that was it in terms of questions that were submitted for now. Like we said, and everyone has said already, if there's any further questions you want to follow up on, please do submit them to the whatworks@effectiveservices.org email address.
So over to me now, Laura, is it? Yeah.
Yeah.
Yeah, thanks, Lorna. Thanks everybody. Just a couple of things before I close. Jack mentioned the web development for the hub. So the department is working with the web provider IT company, and we will have an online user interface on the Hotworks website when it's launched, probably March next year. That's what we're hoping. It'll be really easy to access. So just to let you know that. Also, I mentioned the Festival of Learning there earlier. These are we've 3 webinars lined up for that, starting Monday, the 21st of November, with the Minister launching. It's a hybrid event. It'll be in the Ashton Hotel in Dublin, with access online as well. As I said, the Minister will be launching. We've 3 webinars that week. So we've a great range of international keynote speakers, Irish and international panelists. We're just fine tuning the program. We'll be sending out a save to date email in the next 2 days, just with a bit more detail on the Festival of Learning. So please get yourself onto the Hotworks mailing list if you're interested. We had a great, I think, attendance last year. I think it was nearly 800 attendees over the three webinars we had last year. So and look out for further information on the Hotworks website. So with that, I'd just like to thank you all for attending today and for your interest in the Evidence Hub. We think it's a really exciting project. It's going to be a first for Ireland. And you know, we have great expertise on board already with Jack and his colleagues in Early Intervention Foundation, and also Centre for Protective Services, who've been great in helping us with the logistics and advice. So I really hope you find it interesting and helpful as you consider submitting your application. And as Jack said, the deadline for submissions is the 8th of November, so it's about 3 weeks away. So, and Laura mentioned that if you have any further questions, or if you think of anything after the webinar today, please contact Hotworks at effectiveservices.org. Also look for further information on our website, hotworks.gov.ie. As I mentioned, get yourself on the mailing list if you want to receive ongoing updates. So on behalf of the department, Early Intervention Foundation in the UK, Jack and Mark and colleagues there, and Centre for Protective Services, we'd really like to thank you for attending, and sure, we'll chat to you soon. So take care all. Thank you very much.